Hello, my name is Ravi Vij. I'm from My Cancer Haven, and today in the Conversation with Cancer Experts series, we're back to having Dr. Binod Dhakal on the program, and he is going to now touch on a new topic, which is a recently presented trial, the MIDAS study at the American Society of Clinical Oncology and the European Hematology Association meetings. And this is a trial that garnered a fair amount of interest. I put up a provocative title saying, "Is this the end of transplant?" And so, who else can better opine on this than Dr. Dhakal, who's done some of the pioneering work in myeloma in recent years? So, welcome, Binod.
Thank you, Ravi. Thank you for having me.
So, can you tell us what the clinical trial that we're going to talk about today, what the trial design was?
Definitely. So MIDAS, as the name stands, Minimal Residual Disease Adaptive Strategy Trial, which is based on the MRD, using the different consolidation and maintenance approach. For example, here this is a phase 3 randomized study. Patients get uniform induction with ISA-KRD, which is a quadruplet regimen for 6 cycles, and based on the MRD, they are either randomized to either for those who are MRD negative of 10 to the power minus 5 and standard risk, they are randomized to either ISA-KRD for additional 6 cycles or get autologous transplant followed by 2 cycles of ISA-KRD consolidation. And both of the arm will get maintenance lenalidomide for 3 years. In the other group, which is, of course, a high-risk group where they still have MRD positivity at 10 to the power minus 5, they are randomized into either autologous transplant or followed by ISA-KRD consolidation, or the 2 transplant or tandem autologous transplant, which is usually done in Europe for the high-risk patients. And after that, they get both of the group get iberdomide for 3 years. So this is a risk and response adapted therapy in a sense, because these patients, it's kind of looking at the dynamic risk model. After 6 cycles, if they don't clear the disease, or if they clear the disease, then either you go more intense treatment or less intense treatment, and look at the outcomes after that. The primary endpoint of the study is looking at the MRD negativity rates after consolidation. For example, for both the groups, it is after consolidation, means either after transplant or tandem transplant in the other group, or ISA-KRD consolidation in the group 1.
So it seems like the major emphasis on this presentation was on arm A and B. We'll talk a little bit about arm C and D, the high risk group, but it was the standard risk group that was the major focus of the trial and some of the discussion that ensued. We don't have any data, I think, at the moment on the post maintenance phase, as you said. So we're talking about the data post consolidation. So there has been some previous presentations